Welcome to Conversations on Healthcare. This week we revisit our interview with former Congressman Patrick Kennedy, founder of the Kennedy Forum. Now, here are your hosts, Mark Masselli and Margaret Flinter.
We're speaking today with former U.S. Congressman Patrick Kennedy, founder of the Kennedy Forum, which seeks to advance policies and programs that advance mental health parity and equal access to treatment.
Congressman Kennedy was a chief sponsor of the Mental Health Parity Act, which passed in Congress in 2008. Also, founder of One Mind for Research and a co-author of A Common Struggle, which chronicles his own family's generations-long struggle with mental health and addiction challenges. Congressman Kennedy, welcome back to Conversations on Healthcare. It's been quite a few years.
Thank you. It's great to be with you guys again. And thank you all for all that you've done in your lives and careers to advance public health. And really pleased to be with both of you. Thank you.
That's great. And, you know, you've called the COVID-19 really a watershed moment for mental health. And I don't think there was anything that could make it worse before. But obviously, COVID-19 really created so much sorrow. And it increased the unmet mental health and addiction needs. It's was exacerbated by the pandemic and really has led to increased depression, anxiety, overdose, and a huge increase in suicides that we've seen all across the country. And the pandemic truly amplified the awareness of this pervasive issue of unmet mental health needs. I wonder if you could just share with our listeners some of the data on the pandemic's impact on mental health and increased addiction, and maybe just put this in context for our listeners.
It's hard to imagine where healthcare doesn't include mental health care. It's just inconceivable when we know of the neurobiology behind depression, anxiety, addictions of all kinds, schizophrenia. We know these are all biological illnesses, heavily genetic illnesses. Yep. Just like other illnesses. And, you know, I was honored to be the author of the Mental Health Parity and Addiction Equity Act, which passed in 2008. And frankly, it kind of went under the radar screen. Most people don't even know it's the law. People weren't focused on it. And because of the shame and stigma around mental illness and addiction, we've never created a movement like breast cancer or any other AIDS movement. There's just been no public advocacy to speak of when you think of it in relationship to the fact that it affects every single American. And the pandemic clearly, I think, brought us out of the closet, so to speak, because everybody could identify with what mental health meant after the pandemic, because everybody was affected either directly or through their family directly. The impact of the uncertainty, the anxiety, the dislocation, all of that rolled into a lot of other things, including the racial pandemic. And there's just an awakening right now. It's kind of a moment of clarity is what we say in recovery, you know, where I think as a nation, we finally come to the realization that we have been in denial. You know, if you want to compare our country to someone who has been sick and hasn't recognized their illness, because the real characteristic of mental illness is the failure to have insight into your illness. In other words, I've been in active addiction most of my adult life. I never understood quite how dysfunctional, how ill I was. And of course, we all know about the enabling that goes on around us with all of our friends and family. And in essence, it takes them hostage too, because once someone around you suffering, you're suffering too, indirectly, but nonetheless still suffering. We as a nation have just really never wrapped our arms around how much of an elephant this is in our nation's living room, and how we as a society have failed to even have the conversation like we would if we were an individual family and one of our family members has addiction or alcoholism. So I think that both on a personal level and on a societal level, we're ready to have that conversation. And to your point, the indicators are off the charts. I mean, we're losing twice as many people as we lost during the height of the HIV/AIDS crisis.
Right.
and we're spending 1/5 the amount of money as we dedicate it to fight HIV/AIDS. So we may think, because of all the headlines, that we're actually tackling mental health and addiction. And I can tell you, as a member of many who are on the front lines, we haven't barely scratched the surface of tackling this illness. And it's all seen through the prism of the money. Follow the money is the famous words in Watergate. And it's the famous words, if you really want to know where someone's priorities, follow the money. And the money has not come into this space. We still treat mental health and addiction as a grant. SAMHSA is the leading agency. God bless them. I love SAMHSA. But it reflects the fact that insurance still does not reimburse for mental illness and addiction in the same way that it reimburses for medical and surgical care as is required under federal law. So, I mean, if this were any other illness, we would have been doing a lot more by now. We spent trillions on cancer, and thank God we did. Every one of my family members have had cancer. But no one asked when we were spending that money, was it worth it? We all knew as a nation that it was good for us collectively as a nation to lead on biomedical research into cancer. We have not done the same in terms of our neuroscience priorities. And we've certainly, in terms of the application of the federal law, never done what we needed to do in terms of enforcement for the provider end to make sure more Americans get access to mental health services as they are today.
Well, Congressman Kennedy, as always, and I remember this from the last time we had you on the show, I just so appreciate your clarity and your passion around this. And I'm going to ask you to do something that might be challenging. I'm going to ask you to find some silver linings here and some paths forward about what might be happening that might give us some hope for some change down the road. We think going forward, we need a couple of things clearly. Certainly integration of care, which is probably well underway in the clinical arena anyway, bringing primary medical care, if you will, and behavioral health care together, not separating them out into domains distant and unrelated as we have in the past. Certainly equal treatment coverage for mental health and addiction services under all payers and insurances, and of course, the money. So we're seeing a lot come through in various plans for additional investments in resources in public health and care, kids, adolescents, and so forth. Share a couple of things that you have on your radar that you're really fighting for or advocating for that you think help us move past this public health crisis. It was a crisis before COVID. As Mark said, it's just a crisis that's gotten even worse. What are the things you're really putting in front of legislators or clinical leaders' agenda to move forward?
Well, I couldn't be more excited for where we are. I believe mental health care will be reimbursed. Mental health care will be reimbursed service within every public school in the nation within the next 5 years. I think if we want to address mental health of our children, which is also at the tip of this pandemic, we're going to need to do that. I think we're going to have mandatory social emotional learning curricula in every public school in America. I think we're, in terms of criminal justice, I think we're going to have a whole new view of how we view recidivism, and we're going to understand that so many who are in the prison system are people who are victims of trauma, severe trauma, and I think if we address some of that, we're going to reduce recidivism, not only reduce the cost of our criminal justice system, but also reduce the number of people who are victimized because hurt people hurt people. And if we understand that, we're going to start to treat the hurt so we can reduce the total number of people that are continuing to be hurt in this cycle of violence. I think that, in our, not only our education, our criminal justice, and our healthcare workplace, I think there are going to be huge changes in the way mental health is now seen as a priority. Let me just finally say, I think there's greater neuroliteracy. In other words, I think there's going to be a greater understanding for mental health hygiene. You hear about the importance of sleep over here and meditation over here and eating right and exercise. But I think that we're going to have, as a nation, want to have a toolkit to learn how do we modulate our own emotions, how do we identify counterproductive thinking patterns, how do we supplement those counterproductive thinking patterns with productive ones, and how do we learn about our brain, our neurobiology, how our thinking affects our acting, and how do we interrupt behavior by moving upstream. I think all of these things mean that we're really in the golden age of understanding mental health in a whole new way, not just as a mental illness, okay, which is all we kind of think about when we talk about these issues, is we think of people with addiction and mental illness. But really, every one of us on the spectrum has, from time to time, various challenges. And also, what do we do to maintain our mental well-being? In other words, so this is not the purview of just people with a diagnosis under DSM. It's really all of us. Mm-hmm. And I think that's an exciting change that I've seen throughout this pandemic, is now everybody's recognizing that they need to strengthen their toolkits personally and in their family to help their own mental health, whether they're already suffering from a condition or whether they feel they might end up in a condition if they don't do a better job at meeting the needs that they have.
I was thinking as you were talking about this golden age of mental health awareness, just the struggle that you went through on crafting the Mental Health Parity Act, where in 2008, where you probably needed a lot of charts and graphs, but you started off this conversation that people are starting to feel this. It's in their household, it's in their neighborhood. Whole different experience in terms of promoting the advocacy work you had to do. Because I think it was going in one ear and out the other in 2008. Graphs, charts didn't work. You had to have this experience happen to you. And I think that's an opportunity that we can't miss, right? That this is now something that's shared by everyone. And now we've got to frame this up. And I'm just wondering now, you've got the Biden administration in charge. What are the policies that they're going to put into play to increase this momentum? We cannot miss this opportunity because the window, we know, will close, right? We've all been on this cycle, whether it was domestic violence or HIV or whatever. You ebb and then you flow and then it gets missed. But right now, we've got the Biden administration in charge. What are the things that they can do? And I know you've been lauding them around the American Recovery Act, the 2022 budget proposal, really this wider access to buprenorphine, a bigger role for things that we're fascinated about in the federally qualified health center, community health center world, but community mental health as well organizations. So walk us through this unique moment that we have in time. And we've got to seize the moment. What's the agenda for the Biden administration to seize it?
So we're now looking at all aspects of health. And I really appreciate that the Biden administration has fantastic policy advisors at every level of government. And they understand you got to deal with the social determinants of health. We got to understand the impact of the racial discrimination that so many of our fellow Americans have been suffering from for years, and many times unaware of how that affects them because it's more vicarious. They see people who look like them beaten and killed on TV, and there's an impact to all of that. That trauma has never fully been dealt with. We have to deal with it. I think the Biden administration's committed to doing so. That's going to help our overall well-being as a nation. I just think the interconnectedness, and now if we're moving towards value-based care, and we're expanding, thankfully, prospective payment models, and we're looking at, thankfully for Debbie Stabenow, the Excellence in Mental Health and the CCBHCs, we're looking at the idea that we wrap services together and we're identifying, do they have a stable place to live? Do they can have supportive employment? That's going to make a huge difference in their success in managing their mental health and physical health. And that if we start to look at the bottom line, we'll see that these things that may not be medical may actually have as big, if not more, of an impact on the medical spend as anything else that we could look at. We never would have had that perspective a few years ago. Yeah. And so I really think this is the exciting age because I've been for obviously parity. I want our fair share. The bottom line is mental health may be the biggest force multiplier that the medical system's never seen before. Right. And once they start to evaluate that the dollar in is worth, 4 out if they're investing in mental health, maybe we don't want parity because we're going to be getting more than our fair share because people will finally realize that the rest of the medical system has been wrung dry of savings This is a part of the system we've never wrapped our arms around. We've never properly focused on quality. We've never focused on translation of evidence-based treatments so that we can actually have expectation that people get better. We've never monitored them in a chronic care manner. We've never brought in the value of technology as a remote monitoring device to keep people like myself who have both mental illness and addiction are better able to monitor that, like a Fitbit, right? We're now able to take facial recognition with the telemental health and assist clinicians in being able to better diagnose us. We're going to be able to take voice recognition and modulation, tell where we are on a mood meter. I mean, it's sci-fi, but it's not. Yeah. And the good news is that we're not going to be casting people out into the hinter world when they leave the doctor's office. They're always going to remain connected. And for people with a pernicious illness that's constantly looking to take people down, such as addiction and mental illness, this new environment is very conducive to the kind of wraparound care that we ultimately have always wanted. And now I think are going to start to get through some of the reforms that CMMI has taken up and CMS is going to move forward with, and the payers across the country through these ACO models are starting to look at as well.
Well, that is great. And we couldn't agree with you more based on our survey of the landscape of what's out there, from predictive analytics to AI and incredible uses to help advance things. But I want to say that you're an incredible storyteller. You come from a long line of storytellers, I think, in your family. And storytelling is so important in healthcare and in policy and politics and every place else. But I'm really curious, your book, A Common Struggle, really is very personal, talks about your own family struggles with these issues, and makes the case so clearly that these transcend any kind of socioeconomic spectrum. How have your public revelations and those of other well-known people shifted the narrative around what we know is truly a family disease, but for a long time was the family disease that nobody talked about and nobody really had?
So we know that if we intervene on stage 1 cancer rather than stage 4, we have a much better shot at saving someone's life. And that's true in mental health and addiction. The earlier they intervene, the better results. But unfortunately, our MO is we wait till someone has a stage 4 illness before we actually treat. And that's exacerbated by the fact that we want to keep these illnesses secret. And that is a pathology on top of the other pathology of lack of insight about one's own illness, which keeps people sicker than they ever need to be, for longer than they ever need to be. And the real change we can make that can dramatically change outcomes is by opening up the light of day, understanding that these are illnesses, that we can treat these illnesses. And the key to it is getting rid of the secrets, the shame, the stigma. And that's easier said than done. Mm-hmm. I've been really after ending the discrimination, because I'm not sure we're ever going to get rid of the attitudes towards people who have these illnesses, because let's just be honest, it's in our human nature to judge others when we see them acting in a way that we want to condemn or feel is, displeasurable. We want to show them, not remembering that no one in their right mind would act in those ways if they were healthy, that we all want to be loved, respected, embraced, connected. And when someone is getting up every day and feeding an addiction of any kind, they're jeopardizing their relationships with their loved ones, their employers, they're jeopardizing their own health, even their freedom, because they can commit crimes. So this is not something that people are doing of their own volition. We need to save people. They're being held hostage by their illness. And I like to think of mental health care providers as those 911, special response force that go in there and help kick down the doors and bring people back into the light and save them from themselves, from being prisoners of their own minds. And the first thing we need to do is have that conversation, understand this, And we're only as sick as our secrets is the refrain in recovery that we use. And it's very true. And our country has been sick because we've collectively been keeping this quiet. And we have to open up individually. And and if we do individually, then guess what? There's going to be a parallel opening up on a societal level. Mm-hmm. The problem is, how can you expect Congress to do more if they're not hearing from us? Mm-hmm. And if they're not hearing from us because we're feeling shamed, then it's easier for them to overlook our interests in favor of other interests of people that are much louder than us. And so if we want to see things change, we have to start in our own lives, and we have to be more open about discussing these things so that we can see more people helped through recognition that these are illnesses that can be treated effectively if treated early. And that can only happen as if people start talking.
We're speaking today with former U.S. Congressman Patrick Kennedy, founder of the Kennedy Forum, which seeks to advance policies and programs that advance mental health parity and equal access to treatment. You know, I want to look at both ends of the spectrum. You were just talking, and we're sort of geeks here too, about the technology and sort of the AI and other things that really can be force multipliers as we think about the scale that we need. But I was struck by your saying early intervention is the key. Mm-hmm. Now, we're in 180 school-based health centers. We know that every school, our focus is to make sure that every school, from kindergarten or preschool up to high school, there's a mental health counselor in there. And so we've been doing our part. We've been working with the School-Based Health Alliance, Robert Boyd and his team. They're doing national thing. But both of these are important, right? We need to sort of advance it. We've seen, because of COVID-19, the advent of telehealth being used in mental health. That's and right. Parity being played between the phone call and the video, which is so critical because the population we care, living at or near poverty, 90% of the people we care for. So we need to make sure that that's available for them because that will be so essential. So we're seeing this enormous transformation happening, but we want to also make sure that fundamental early intervention really in the schools are the best place to begin this conversation with young people, to have it as sort of normalizing their experience. So, you know, maybe tell us a little bit about both sides. You told us a little bit, and I know you're at a virtual behavioral health tech summit today, so I'm sure learning a little bit about exciting things that are coming.
Well, my wife is a public school teacher, veteran of the classroom, 6th, 7th, and 8th grade for 14 years. The stories she tells are, I'm sure, anecdotal to what any teacher in America could tell, that she knows which kids need help, and she has no tools as a teacher to help them. They're crying out for help, and the best thing she can do is send them to the principal's office. That has to change. I believe the back to school money, $130 billion has been set aside. Mental health is quote unquote optional. The Kennedy Forum, led by my wife, Amy, really wrote a letter to the Department of Education. We're expecting to get a letter back from them shortly, recommending series of evidence-based interventions that we can pay for in this narrow, finite time where the budget authority will then run out. So unfortunately, we can't bake it into the overall budget at the local level, but there may be things that we could do to bridge these local school systems into an ongoing, continuous funding for school-based mental health to fund the very clinics that you've just spoken about. And if we can tie that to Medicaid and get waivers to reimburse for school-based telemental health, we couple that with social emotional learning. And on the advocacy side, we could get NEA and AFT and all the others to come to the realization that education today cannot be done effectively without having mental health, social emotional learning, coping and problem solving skills all baked into the day. And if it isn't, numeracy and literacy are going to go by the wayside if people can't focus on what they're learning, and because their amygdalas are on fire because of trauma at home and because of the lack of tools to help them modulate their own feelings. I just see this as, again, a real historic opportunity for us to change how we define education and not segment it away from mental health or healthcare, but combine the two, which is what you have done so effectively, and why I'm so grateful for all that you've done to help us advance in that space.
Well, I can see we've touched on a subject of common passion to all of us, which is to get behavioral health services where the kids are, and certainly as they come out of school this summer, hoping to continue those services over the summer. And as they head back, we have no excuse for not being ready to meet them with the services that they need. So I want to talk about another dimension of this that we haven't really touched on. Love the clarion call for a behavioral health provider in every school, and sometimes you need more than one. Where is this workforce coming from, right? We've talked about the need to really educate and train, both of those things, clinically train a whole new generation of behavioral health clinicians. And some will be peer counselors and paraprofessionals, but a lot of people need the full training, licensed independent providers, whether clinical social workers, psychologists, addiction specialists, psychiatrists, psychiatric mental health nurse practitioners, and the like. And we're making our contribution to the effort along with many health centers around the country around training. We operate postgraduate residency programs for psychiatric mental health NPs and interns and externs and postdoctoral psychology residents, peer navigators, the whole bit. It's not enough. And that we haven't seen as much of a subject of conversation. Certainly the opioid crisis made that really clear to us. Not enough people who could treat. Is your institute and your work focusing in on that next generation of behavioral health and addiction workforce at all? And if so, share with us what you see as some areas of promise.
Yeah, so I'm really proud to say I left the public sector. I jumped into the private sector. I co-founded a company called PsychHub. And PsychHub is in this space. It's about educating all the behavioral health providers to practice in an area of specialty so that we could get payers to curate providers based upon those diagnoses that they treat, rather than being one-size-fits-all single shingle providers that treat depression in the morning and eating disorders in the afternoon and grief in the later in the day. We want to have the kind of personalized medicine that we expect in the rest of healthcare. So PsychHub trains behavioral health providers. It trains regular medical clinicians because, frankly, if you're a cardiologist and not dealing with depression, and you're having a post-heart attack patient is 4 times more likely to die of a heart attack if they've got underlying depression, or diabetic who doesn't have proper treatment for a mental health or alcoholism problem. I mean, it's all interrelated. We have to do a much better job at certifying kind of expertise amongst those who are professionals, but also amongst everyone else, because it will be some time before we get the workforce up to speed to carry us to meet the need that's out there. Right now, it should be all hands on deck, meaning we need everybody. So not only do we repurpose the primary care system, but let's repurpose the specialty system. My sister had cancer. They never even thought of treating her for depression and anxiety as her oncologist. That was not in his training whatsoever. That's wrong. That's got to change. Then we've got to empower family members. Family members have to be part of the treatment, so they need to be empowered. And then we need to have patients be able to take more management of their own illness. They need to be trained. They need to know what they should be looking for from their therapist. They can't just walk in and wonder, as I did for a better part of my life, going to therapy where all I did was ruminate about the past, as opposed to coming up with a specific, CBT, cognitive behavioral therapy component where I acted my way into different thinking, which is essentially what 12-step recovery is so effective in helping you do. All I'm saying is, I am entirely in sync with you on this. We're trying to make sure that bus drivers, custodians, police, everybody, there's nobody that can't benefit from some mental health ally kind of training. So that's what we're looking to also provide at PsychHub, because, everybody, and as we move to this 988 system, which is going to complement our 911 system, it's going to be even more important that we have kind of EMTs for mental health in every community. That means we got to build out the infrastructure. I'm very excited that, I think firefighters are already doing a lion's share of this already. Yeah. Fires have gone down, but mental health crises have gone up. Yep. We need to make sure that they are really understand this is part of their core business, which in reality it is already, but that they get the complement of training so that they can do the job that we need them to do in every community in this country, which is why we're so lucky to have them as first responders, and make sure that it's culturally competent. Okay, so the other part of this piece is that we don't really have a provider community that necessarily looks like America. We need to have a much better representation of all of America in our provider ranks so that people can feel when they deal with these vicarious traumas due to racism that they can talk to someone with cultural competence, understanding cultural framework, and humility, cultural humility. So a lot to do, but as I said, very exciting. And I think we need to revamp our, tuition loan forgiveness, and our do our high need categories for loan forgiveness, and emphasize those areas in mental health, as particularly amongst kids and adolescents, which we have such a huge pain point on. And we need to do all those policies to help meet the need as it is today.
We've been speaking today with former U.S. Congressman Patrick Kennedy, founder of the Kennedy Forum and advocate for mental health parity and equal access to care. You can learn more about his vitally important work by going to patrickjkennedy.net or thekennedyforum.org. Follow him on Twitter at PJK4BrainHealth. Congressman Kennedy, thank you so much for continuing to be a tireless advocate for mental health and addiction parity, for pushing for policies and best practices to improve mental health care and access, and for joining us again on Conversations on Healthcare.
It's been my pleasure. Thank you both for all your service.